As explored in the last section, there are a number of issues that can impact on health and individual human development of pregnant women and their unborn babies. In response to these and other issues, a number of programs and strategies have been designed to reduce the risk of negative outcomes and promote the health and development of mothers and babies during the prenatal stage of the lifespan. These programs and strategies exist at a government, community, and personal level. Government and program strategies. All levels of government, federal, state and territory, and local implement strategies and programs to promote the health and individual human development of pregnant women and their unborn babies. Federal government. Medicare is Australia's universal health insurance scheme that provides free or subsidised treatment for all Australians through the public health system. Pregnant women can access a range of Medicare-funded health services throughout their pregnancy, including free treatment in public hospitals. By making healthcare more affordable, Medicare increases accessibility to prenatal healthcare, which can assist with early detection of issues during pregnancy and medical interventions when required. Medicare also assists in providing professional health workers such as nurses, midwives, doctors, obstetricians to assist with the birthing process at no charge to the patient. Food Standards Australia and New Zealand is the federal government body responsible for making laws related to the food industry. In Australia, numerous laws have been implemented in an attempt to increase the intake of nutrients required for the optimal health and development of unborn babies. Iodine and folate intake specifically have been shown to be deficient across the population, and deficiencies of these nutrients can contribute to a range of birth defects during pregnancy, including neural tube defects and impaired brain development. Mandatory fortification laws require food manufacturers to add iodine and folate to specific food products. Since 2009, all salt used in bread manufacturing, except organic bread, must be iodized salt. Similarly, all bread products, except organic bread, must contain added folate. Bread was selected as the subject of mandatory fortification laws as most people consume bread on a regular basis, and regular consumption may decrease the risk of the defects associated with deficiency of iodine and folate. The Pregnancy, Birth and Baby Service provides information and advice on topics such as maternal health, nutrition, breastfeeding, and baby's development and sleeping habits, as well as direction to maternity-related services, including specialists and support services. Through the Immunise Australia program, the federal government provides free influenza vaccines for all pregnant women. Pregnant women are at high risk of severe consequences of influenza infection. The Australian government aims to provide greater protection against influenza for pregnant women, making influenza vaccine available free of charge. The National Prenatal Depression Initiative is a federal government strategy developed in conjunction with all state and territory governments. It aims to promote the mental health of pregnant women, providing routine and universal screening for prenatal depression, follow-up and support and care for women assessed as being at risk or of experiencing prenatal depression, workforce training and development for health professionals, research and data collection, national guidelines for screening for prenatal depression, and community awareness. The Victorian Government. The Victorian Government has established the Having a Baby in Victoria website that aims to educate pregnant women and those planning pregnancy. It contains links to health services, dietary advice, general pregnancy information, and information about the availability of support services. The Maternal and Child Health Line is a Victorian government service that is staffed by qualified maternal and child health nurses who provide callers with information, support and advice regarding health, child health, maternal and family health and parenting issues. This is a free service for all Victorians. The Better Health Channel provides online health and medical information for the Victorian community. It contains information to educate parents about issues relating to pregnancy and childbirth. Fact sheets are available on topics such as folate during pregnancy, fetal alcohol syndrome, pregnancy and exercise, preeclampsia, gestational diabetes, and ectopic pregnancy. The Healthy Mothers, Healthy Babies program aims to promote prenatal health of pregnant women and their unborn babies by addressing risk behaviours and providing support during pregnancy. The Healthy Mothers, Healthy Babies program targets pregnant women who are unable to access prenatal care services or require additional support because of their socioeconomic status, culturally or linguistically diverse backgrounds, Aboriginal and Torres Strait Islanders' descent, age or residential distance to services. Local government. Maternal and child health centres are located in every local government area in Victoria, which are jointly funded by state and local governments and usually managed by local governments. The centres are staffed by highly qualified maternal and child health nurses with support from a range of other health professionals. Pregnant women can seek advice relating to their pregnancy and receive prenatal health care at these centres. Community programs and strategies are often developed by non-government organisations and have a specific focus with regards to prenatal health and development. Beyond Baby Blues. Beyond Blue is an independent non-profit organisation working to increase awareness and understanding of depression and anxiety in Australia and to reduce the associated stigma. Part of Beyond Blue's work relates to maintaining positive mental health during pregnancy and early parenthood. Through the Beyond Baby Blues initiative, a range of resources are provided for health professionals, women and their families, including online training for health professionals, printed resources for health professionals, resources for expectant and new parents, the Just Speak Up website, which provides a forum for people to share their experiences with prenatal and postnatal depression and anxiety. U2. The initiative was developed by Diabetes Australia with the aim of preventing gestational diabetes and supporting those with the condition. The U2 website provides practical advice relating to healthy eating, exercise, and prenatal health care. The online blog allows women with gestational diabetes to share their stories and provide support to others with the condition. Australian Action on Preeclampsia is a Victorian association set up to provide support and information to families who are experiencing or have experienced preeclampsia. The organisation aims to educate the public and health professionals about the prevalence and the risk of preeclampsia and campaigns for greater awareness of this condition. AAPEC publishes regular newsletters, provides brochures, organises educational seminars and workshops, and raises funds to promote research into the prevention and early detection of preeclampsia. Personal program and strategies that individuals can employ during pregnancy relate to the addressing the factors that can be modified to optimise the health and individual human development of themselves and their unborn babies. Examples can include maintaining healthy body weight can reduce the risk of gestational diabetes. Ensuring nutrient intake is adequate leading up to pregnancy and taking supplements if required, specifically folate and iodine supplements, can reduce the risk of neural tube defects. Having regular prenatal health checks assist in monitoring health and implementing changes required to promote health and individual human development. Increasing education levels relating to pregnancy, including attending healthcare classes, provides information and strategies relating to the birthing procedure. Avoiding teratogens, such as raw fish, soft cheeses, alcohol, drugs, x-rays and tobacco can reduce the risk of conditions such as low birth weight. Ensuring vaccinations are up to date prior to pregnancy reduces the risk of infection and disease during pregnancy. Reducing the risk of infection by avoiding contact with those who are ill and maintaining adequate levels of hygiene. And reducing stress levels can assist in maintaining optimal mental health.